Hi, my name is Dr. Carmen Jones, and I'm a licensed naturopathic doctor. I'm excited to share with you nutritional considerations around the postpartum mom. I'm going to share with you a presentation, and you will also have handouts associated with it with some specific nutrient and micronutrient recommendations. Okay. All right, so I'll just get started. So postpartum nutritional considerations. So from my perspective, I'm a licensed naturopathic doctor, so my perspective is a little bit more holistic and taking the whole person into consideration. And there are a lot of changes in being a mom, right? There's a lot of changes that are happening in our body in pregnancy, and those changes still continue to occur in postpartum. We have so many resources available in terms of books and apps and programs that will teach you how your body is changing throughout pregnancy and the size of your little one, how your little one is changing in the uterus throughout their pregnancy. But we don't have a lot of resources for what happens after baby is born. Okay? So hopefully you're getting a lot of information in this workshop that you're attending. Hopefully this will give you another layer to postpartum care and what to be on the lookout for and how you can best support your body and baby. Okay. So today we're going to discuss ways to support your body, the healing mechanisms, physical changes, emotional changes, even breastfeeding resources to achieve your optimal health, so that to make postpartum a little bit easier for you and for your new little one. So why even talk about this? Okay. The reason why is because, again, there's a lot of changes in postpartum and there just isn't always as much information out there. In the conventional medicine world, oftentimes when we experience changes through our after pregnancy, after baby is born, we may experience a lot of changes again in our physical health and our emotional, mental health. And oftentimes they get pushed off as, oh, it's just being part of being a mom, right? Part of being motherhood. Welcome to motherhood. Now you have all these health concerns or these hormone imbalances. That's not good enough, right? Motherhood's not a diagnosis. From my perspective, there are a couple of studies that I want to go through today, but one that I want to highlight why this is important to talk about and to share with people. This study was done a little while ago, but they looked at 11,701 postpartum women. And what they found out of that 11,000 is nearly half, of 47%, had health problems within 3 months after giving birth, which continued for more than 6 weeks, which they had never experienced before. Okay. Some of those symptoms and changes in their health lasted for months or years afterwards. I think this is really significant to underline. This is why I want to share this with you, because oftentimes when after labor and delivery, right, after baby is born, especially in the States, there's a lot of push for mom to bounce back, right? Bounce back to her level of productivity, bounce back to her pre-baby weight, bounce back, right, to your energy, and you just kind of supposed to hit the ground running. Well, for a lot of us, that doesn't happen, right? There are a lot of ups and downs and changes in our body that occur. So being aware of those and understanding, right, how we move forward, how we grow as a mom versus just trying to push through and just bounce back, isn't completely realistic. what we see in postpartum, some common symptoms, right? Maybe things like insomnia, night sweats, hair loss, headaches, anxiety. And some of these may be a little bit self-limiting, and some of these may last 3, 4, 6 months after baby's born. Um, what I see a lot in my practice is people will come in with feelings or questions about hormone imbalance. What we see for women who are perimenopausal or menopausal, we can see these common symptoms again: insomnia, night sweats, hair loss, headaches, and anxiety. And the question stands is that if this is symptoms that started to occur in the postpartum mom, and continues to intensify or get worse when we hit perimenopause and menopause, is this just compounded poor postpartum care that people have experienced in medicine? So we're going to go through some things of some changes in our physical body, some changes in our mental, emotional, and how we can maintain a balance, or how we can correct deficiencies so that this part of motherhood is enjoyable, right? So first, we're going to go into physical recovery. So we know that there's a lot of changes that occur, and some of these changes we can actually work on during pregnancy, right? What's unique about pregnancy versus any other condition, if you will, so we've got 9 months leading up to what life is going to be like after baby arrives. So one of the things I like to highlight first is sleep, okay? Because after baby's born, we know that our sleep patterns potentially could be a little bit erratic, and we could have a little bit less sleep and some changes there. The less sleep that we experience, the harder it is for our body to recover, to regenerate. It's even harder for us to kind of balance out those hormones and produce those pieces of our brain, our neurotransmitters that we need in order to balance our mood. Oftentimes, so sleep is one of those things, again, we can start addressing in pregnancy. There's a lot of research, which I didn't particularly highlight in this piece, but there's a lot of research that associates levels of sleep, how many hours, how restful the sleep that we're getting in pregnancy, and how it directly relates to what our mood, depressive symptoms, anxiety symptoms, even suicidal ideation risks are postpartum or even during pregnancy. So what can we look at? So as far as insomnia, especially in pregnancy, we're looking at eating well, resting well, and getting exercise, okay? Oftentimes in late pregnancy, in that third trimester, people will have a tendency to wake up in the middle of the night, and they might not really know why, or their blood pressure spikes a little bit in the middle of the night. And that can be the most common cause is a blood sugar dysregulation, where our body, the blood sugar drops, and then that cortisol response kind of wakes you up in the middle of the night. And then it's hard to go back to bed or find a comfortable position to go back to bed. And we can deter that a little bit by optimizing our blood sugar. So eating high protein snacks in the evening, usually a high fat, high protein snack half an hour before bed, handful of nuts, seeds, nut butter, cheese and crackers, things like that, can help to maintain that blood sugar and that blood pressure while we're sleeping, so that we don't have that like jolt awake that makes it challenging for us to or that creates that insomnia pattern. So moving into right after baby's born, okay? I hope you can still see me. The nutritional needs right after birth, okay? There's a lot of changes, right? Depending on what somebody's labor and delivery looks like, whether we're delivering at home, whether we're delivering in a birthing center or in a hospital, our body's going to undergo a lot of changes. So what happens soon as baby is born, right? We need to focus on nourishing foods, okay? Nourishing foods that rebuild the blood, that help with strength and energy, okay? From a Chinese perspective, after delivery, it can look like what we call a yin deficiency, but essentially what that means is we lose a lot of heat. So we need to warm up mom, okay? We need to provide foods that are very nutritious, foods that are warming, like curries, root vegetables, something that's high in protein and complex carbohydrates. Okay? Depending on how long your labor looks like, whatever it looks like, sometimes you may be exhausted, right? I'm going to encourage you to eat a snack before you sleep, okay? Because what happens, we're exhausted, right? And sometimes the idea of eating is the last thing that we want to do after giving birth. That is not on your mind. Not in the least. So whoever your support system is during that time, let them know and tell them and to encourage you to have a snack, because all you may want to do is just sleep, depending on how labor and delivery goes. And we need those high proteins, those complex carbs, one, to start stimulating your body's ability to heal itself after labor, right? After delivery, whether it's vaginal or C-section birth, your body's going to need to repair after that. And so we need those complex proteins and those complex carbohydrates. We need to maintain your blood sugar, okay? After labor and delivery, you go through a lot of physical exertion, right? More physical exertion than any other exercise routine or triathlon or anything you can imagine, right? Your body's going through an intense, high energy, high caloric demand when it goes through labor and delivery. So we need to replenish that. So within an hour after birth, it's really important to stabilize that blood sugar. So try and get those high protein, high complex carbohydrate snacks in. Again, eat first and then sleep. So things like toast and eggs, chicken soup, miso soup, something that's easy to digest. These are also foods. I'm a big advocate of soups and even maybe some curries, because they're easy foods to prepare ahead of time, right? And they're somewhat easy to transport in a sealable container to have with you during delivery for your support person to share with you. All right. So again, post-delivery, physical recovery, nutritional considerations we need. So your tissue is going to be healing, right? Whether it's the perineum, the vagina, the incision site, your body's going to be healing. So we need to increase our protein, whether it's animal protein or vegetable protein. We need to make sure that we're getting adequate amounts. Vitamin C. I'm going to talk about vitamin C a few times in this presentation. So vitamin C is essential in order for our tissue to heal. So it helps to kind of create sort of this kind of scaffolding in which our tissue can repair and heal. High fiber diets. This is also good in that third trimester to help promote soft bowel movements. Bone broth and gelatin. So when we're thinking about all the changes that happen physically, right? Our uterus is shrinking, the vaginal canal is changing, our digestive tract is changing, not exactly to pre-baby or pre-pregnancy, but it's changing a little bit closer to baseline, okay? So by increasing bone broth, we're adding those amino acids and those minerals our body needs. Grass-fed gelatin, again, helps with that connective tissue support. So we're trying to, stimulate healing a little bit quicker in the body. As far as lochia, vaginal bleeding, which can occur anywhere from right after baby to even like right after delivery to even 2 weeks. Postpartum is going to require a lot of iron-rich foods in those first few weeks. Okay, iron-rich foods are things like red meat, red beans, beets, dark leafy vegetables, raisins, apricots, even blackstrap molasses, things that are very concentrated in minerals. And you'll see this again, recurring theme when we talk about healing in the postpartum mom. Those minerals and those nutrients are going to be very important, essential in order balancing out your hormones, producing the neurotransmitters in your brain that regulate your mood, as well as the physical tissue recovery during the postpartum. Okay. Another physical change we can see is shakes and sweats. Now, some moms may sweat profusely or experience like an intense period of shaking. Usually that's not because we're cold or because we're hot, but because of all those hormone changes, your body's trying to get rid of excess fluids. Okay. And so it does this with these autonomic responses with shaking and sweating. So we can promote that process a little bit smoother by adding warming teas like cinnamon or ginger. These are also anti-inflammatory, but they can help us kind of get through that period of sort of that shakes and sweats into, they're a little bit diuretic, so they can help to move that fluid out a little bit quicker. So I wanted to share some recipes with you for that. Okay. All right. So if you're considering breastfeeding, as if you're considering breastfeeding, there are some nutritional considerations to also take into account. The breastfeeding demands. So oftentimes, in order to set your body up for optimal breastfeeding, we need to aim for 500 to 800 calories in addition to your daily caloric needs. Now, a lot of folks sometimes we have this thought process that after baby's born, right, we're going to bounce back, we're going to start dieting or changing our diet to have less calories because now you're not growing a child. But if you're breastfeeding, those caloric demands are still really high. Fluids, right? You'll hear about this, I'm sure, from other practitioners, but fluids are so important. We can easily become dehydrated if we're breastfeeding. So making sure that you're drinking plenty of water, at least 3 liters of water a day or fluid a day. Eat nourishing foods. There are like super foods for breastfeeding, and I'm going to share this handout with you as well in your packet. Things like whole grains, salmon, beef, eggs, leafy greens, sweet potatoes, legumes, beans, nuts, seeds, apricots, and dates, and then again, lots of water. The reason why they are considered superfoods for breastfeeding is because I believe in food as medicine. And so a good way to get in our nutrients, those minerals, our omega-3s and fatty acids that are needed for adequate amounts of breast milk, but also to make sure that your breast milk is nutrient dense for baby is really important as well. So adding those ingredients into your diet on a regular basis is going to help to support not only your health and your ability to make breast milk, but also baby's health as well. If you know that you want to try breastfeeding or that your intentions is breastfeeding 100%, these are superfoods or things to start bringing on board even before postpartum in that 3rd trimester. So visit that. And it doesn't matter if you start increasing those foods in your diet during pregnancy or after pregnancy, or even 6 months and you're still breastfeeding after or in the postpartum. Any time within the course of breastfeeding little one, you're going to benefit, both of you will benefit by increasing those super breastfeeding foods. Okay, emotional changes. I know that you guys have probably heard a lot of support and things to look for with emotional changes. I'm going to piggyback a lot of that, but I want to show you from a diet, a nutrition, holistic perspective. Okay. So I'm going to start off with a little research, and I'm going to share a lot of research in this piece, because we know that there's a relationship between our mood in pregnancy and postpartum. Okay, so or during pregnancy and postpartum. There's a couple of studies here that I wanted to highlight, and the first one shows that an unhealthy diet was associated with an increased of depressive symptoms at week 32 in pregnancy. And both of these studies, and if you ever do the homework yourself or start looking, you'll see they always recommend that more studies are needed, which I totally agree with. But for now, we're using what's available. The second study that I wanted to highlight is actually a systematic review. So it looked at 9 different studies. But in those 9 studies, what they found were that healthy diets were inversely associated with depressive and anxiety symptoms during pregnancy. So essentially what that's saying is that the healthier the diet during pregnancy, the less likely for depressive and anxiety symptoms. Yeah. So again, another reason why to pay attention to our diet. This study was a little bit larger. It was also a systematic review, but they looked at 35 different papers, which encompassed 88,051 subjects. Of that, 22 of those studies found protective effects of healthy diet patterns, multivitamin supplementation, fish, PUFAs, polyunsaturated fatty acids, that's like omega-3s, calcium, vitamin D, zinc, and possibly selenium. So this is a pretty significant review linking what our diet looks like in pregnancy, and I would even say into the postpartum, and what our mood changes look like. So some specific components of diet, okay, or specific constituents include vitamin D. There are a couple of studies. This is the one that I liked to highlight. Was a vitamin D study, or vitamin D levels in pregnant women, depressive symptoms, and what that relationship looked like. This was a randomized control trial. And what it found was that early pregnancy, low vitamin D levels are associated with higher depressive symptom scores in early and late pregnancy. So I encourage folks to ask your doctor, or your midwife, or if you don't have somebody, reach out to us. We can teach you how to run your vitamin D levels and see where you're at. Oftentimes in even pre-conception work, naturopathic doctors will run vitamin D levels to make sure that your vitamin D levels are appropriate, or optimal levels even before conception. But making sure. So if you're asking for vitamin D levels, there are different types of vitamin D they can test for. So you want to ask for the 25 OH, 25 hydroxide labs, and optimal is between 60 and 80. This is US conversions. In case there's anybody who is not from the US, reach out and I can tell you what the equivalent would be in a different lab system. So vitamin D, we're going to talk about vitamin D a little bit later as well. So with vitamin D is also omega-3s. There's several studies on omega-3s, EPA, DHA, fish oil. So omega-3 is sort of the umbrella term. We think of it associated with fish oil, but you can find omega-3 in nuts and seeds. Flax seeds are very high in omega-3s. Walnuts are very high in omega-3s. And of course, yeah, fish is a little bit higher concentration. So that's why we often talk about fish. But so this study was a review that looked at the effectiveness of omega-3 supplementation on depression during pregnancy and in the postpartum. And then the second study looked at whether omega-3 supplementation prevented, and whether it was a good preventative or a good treatment for depression. And what they found was that pretty much across the board, omega-3 fatty acids do benefit and reduce our risk for postpartum depression. What we find in pregnant and postpartum moms is that omega-3 fatty acids often become deficient very quickly. And sometimes that's because we don't take in enough omega-3s in our diet through like fish, things like salmon, sardines, cold water herring, fatty fish, or so we may not take in enough fish or a supplement, or just depletion during pregnancy and lactation. So when we're pregnant and our body is reallocating the resources to grow your little one, you are using a ton of fish oil and omega-3s in the development of baby's nervous system, brain. So it depletes our body really quickly. So making sure that we're getting adequate amounts. A lot of times you'll see, and if you look at if you're taking a prenatal and you look at your prenatal, oftentimes prenatals will be higher in DHA because that's a specific omega-3 that helps with our nervous system and our brain health. So one of these studies also recommend rich EPA oil, supplementing with DHA rich oil, because not only did it help to support women in reducing our postpartum depression, but it also helps to support baby's health and even breastfeeding and lactation. Production of breast milk. Not this one particular study found that by supplementing DHA, it didn't actually change our risk for postpartum depression in lactating women. So those are two different things. But so consider paying attention to how much omega-3 DHA that you are getting on a regular basis through diet or through supplementation. Okay, so emotional changes. So we know firsthand, right, that things are going to change. So oftentimes we think of mom brain, baby brain, right? And what's actually happening in that postpartum? Okay, what's actually happening is our brain is changing. So we actually can measure the changes in gray matter in our brain during pregnancy. And what's happening is the higher amounts of progesterone that we have throughout pregnancy actually stimulate more neuronal pathways to occur in certain areas of our brain, specifically what we call the amygdala, the hippocampus. And that is around sort of our primal brain, like our safety brain, if you will. And the reason is when our brain is more aware, you have that heightened perception, that actually makes you more perceptive as a mom, right? So you're becoming more perceptive to baby's needs. So this is what those changes allow mom to recognize the difference between like a cry for food or a cry for attention or a cry for a dirty diaper, right? You pick up on those little nuances because that part of your brain is heightened. The challenge is that part of your brain is heightened at the cost of some other parts of your brain. So that's why that can make us a little bit more forgetful. That can make a little bit more challenging at remembering tasks, at remembering words, where you walk into a room and you completely forgot what you were doing, or you were in the middle of doing something. Somebody told you, hey, we've got an event, or will you bring snacks? And it completely gets lost. That can be because this change in those neurotransmitters because of that drop in progesterone after baby's born. So what can we do? We can also support, again, DHA, probiotics, vitamin D, iron, B vitamins, B12, and methylfolate, I'm going to talk about a little bit later as well, are really important in creating those, or by making available those cofactors for our production of our neurotransmitters that are responsible for our mood, for anxiety, depression, and for our cognitive thinking. Okay, so micronutrients. So you're going to also get a handout that's specifically about micronutrients. I'm just going to touch base on this pretty quickly. There's a lot of different nuances about micronutrients. This is one that I'm going to encourage you to really listen to your body and listen to how things change. The reason why this is important is because oftentimes people will recognize changes in the postpartum as hormone changes, right? Or emotional and mood changes. But in order for us to address those hormone changes and those emotional mood changes from a naturopathic, holistic perspective, we've got to address the micronutrients first. Because if those are deficient and they are not available for your body to use, it's going to be a challenge, even if you start a protocol that addresses those hormone changes, that addresses those mood changes, in order for them to be effective. Okay. And so I tell folks, it's a lot like if you were to be trying to bake a cake and you didn't have the main ingredient, right? If you were making a cake and you didn't have any flour, or you didn't have a main ingredient, your cake's not going to turn out the same. So same thing with our body. When our body's in that healing and repairing process, if we don't have those nutrients or those ingredients available, it's going to be very challenging in order for you to experience the changes of healing if you're deficient in nutrients. So we'll get into it here. Okay. So some of the micronutrients, and again, you're going to get this in another handout that goes in a little bit more detail. But the ones that I want to bring to your attention that we know time after time that are the most significant in postpartum are things like iron, right? We know that your body during pregnancy makes twice the amount of blood that your body needs in order to increase circulation, make sure, baby has plenty of circulation, make sure it's got all the nutrients. After baby's born, oftentimes we lose a lot of blood, and we can have significant amounts of bleeding. So we need to make sure that we're getting our iron in order to rebuild that blood, in order for our blood vessels to regenerate, in order for our brain health and our cellular repair. So there are different ways you can test for iron. Hopefully in the postpartum, you have a practitioner that you're working with who is either keeping an eye on these things or doing some type of assessment or evaluation or labs. If not, definitely reach out to us. But ferritin is a stored form of iron. And so we want to see your ferritin levels be at least around 50. If it's starting to drop, then you're going to be getting closer to anemia. So keeping an eye on our iron, keeping an eye on our ferritin levels. And again, foods that are rich in iron, this will be in your handout, things like beef or red meat, dark leafy greens like spinach, kale, raisins, beets, yeah, figs, apricots, blackstrap molasses, things like that are a little bit higher in iron. Zinc. We don't often always talk a lot about zinc. But zinc is important for wound healing. Zinc is important for our brain health and our mood, as well as our immune system. So oftentimes, yeah, in the postpartum, we want things to be optimal, right? One, your body's healing, but two, zinc is essential in order to produce some of our serotonin. And so that addresses our mood. And then our immune system, you know, to make sure we've got adequate amounts of zinc to have a robust immune system so that we may be able to respond to anything that we may come in contact with. In conjunction with zinc is copper and magnesium. And I should have rearranged those. But so copper is very significant. We actually also double the amount of copper in our body during pregnancy. So we go from about 111 to like 225 micrograms of copper. Now, when we deliver baby and our estrogen is supposed to drop, so is our copper. Okay. And that doesn't always happen for everybody. The studies show us that higher levels of copper is a direct risk of depressive symptoms in the postpartum. So making sure that our copper levels are coming down like they're supposed to is a direct effect on our mood, our hormones, and our cellular health. And the reason why there's a relationship is because if our copper is high, and our zinc is low, we've got to bring those closer to balance. Our zinc helps to lower our copper. So knowing that relationship, I think, is really important, especially if we're starting to experience depressive symptoms or anxiety in the postpartum. Magnesium, there's a relationship between these minerals, magnesium, zinc, and copper. Magnesium, oftentimes we maybe have heard a little bit more about magnesium, and we can see a little bit more physical symptoms when we have a magnesium deficiency, things like muscle spasms or muscle cramps, restless legs, twitching, constipation, or changes with our digestion. Sometimes we have a difficulty with stress. Sometimes that can be magnesium deficiency. So making sure that sometimes we have to supplement that. A lot of our foods doesn't always have high amounts of magnesium. But our minerals in general, zinc, copper, magnesium, we can often find in like our legumes, beans, lentils, our nuts and seeds are often higher in our minerals. B vitamins. So this includes our folate, this includes B12, but also B1, B2, B3, riboflavin, niacin, even, yeah. Our B vitamins are essential for our nervous system and our brain health, right? If we're deficient in our B6, our body can't produce that serotonin and dopamine. It can't produce those neurotransmitters that are associated with mood. If we are deficient in our B vitamins, we can't produce enough progesterone or testosterone. So it's important to recognize, that we're getting our B vitamins in either through supplementation or through the diet. B vitamins are very high in things like nutritional yeast and fermented foods. Now, if you are on a plant-based diet, it will be important, especially if you're breastfeeding, it will be important to supplement B12 in a breastfeeding mom who's on a plant-based diet. So please, take that into consideration. Our trace minerals, things like iodine, selenium, molybdenum, manganese. We don't always pay attention to a lot of our trace minerals, but again, they could be very essential in a changing body, a changing mom in the postpartum. So our iodine directly related to our thyroid. I'm going to talk about thyroid briefly here in a minute. Our selenium has to do with our cellular health. Molybdenum and manganese have to do with sort of that copper balance, but also our magnesium. So taking note of those things. Now, when I talk about micronutrients, some of these we can test for easily, and some of these we can't always test for easily. Or I can't say this not easily. Sometimes testing for some of these may not be as budget friendly. Maybe that's the word I'm looking for. So in your handout, I'm going to list a lot of common signs and symptoms of these types of deficiencies so that you can start addressing those, while you're looking for an assessment or somebody to support you on this part of your journey. Vitamin C, again, it's coming up again. This is essential for our wound healing, but also for our adrenal health, for our hormones and our immune system. Okay. If you're taking a prenatal, continue that prenatal for 6 months. People will often ask, oh, well, they think, well, if they're not pregnant anymore, they don't need to take a prenatal. Prenatals are specifically designed to increase those nutrients and those micronutrients to make them available for a changing body. And so I encourage people to continue them for at least 6 months. If you're breastfeeding, continue the prenatal as long as you're breastfeeding. Okay, some endocrine changes. Now, this you will probably feel firsthand. In the postpartum, after delivery, we know that your hormones are going to change, right? We know that your estrogen, your progesterone are going to drop because your progesterone is going to drop because there's no more placenta creating that progesterone for you. Your estrogen is going to drop. And so the challenge is how well it bounces back. Okay. So those estrogen progesterone levels, we call them supraphysiologic levels when you're pregnant. So that means they are like sky high, which they need to be in order for baby to be healthy. But after delivery, within that first 3 days is usually when you see like those significance, it just falls off a cliff. Okay. And that can be a challenge because that's going to create a lot of changes in our body. It's going to be, create a lot of changes in our mood, with anxiety, with tearfulness. A lot of emotions are going to come up, a lot of brain changes, in addition to how your uterus is shrinking, right? How your vagina is changing, how you're bleeding, how your breasts are changing. All of that is going to occur in a short amount of time. Okay, so be patient with that process. Even though we know that there's going to be a lot of changes, those changes are different for everybody, right? So being patient with that process, being patient with your body is going to be my best advice for that. What those changes can bring on is where we need to start addressing this earlier on in postpartum, from my perspective, than we often do for women. And so some of those changes can be changes in thyroid health, and inflammation of the thyroid. Okay. If people are susceptible, if they had thyroid changes in pregnancy, or if they have a family history of thyroid changes, this does make you a little bit more susceptible. Okay. There's a natural little ebb and flow of changes of the thyroid because of these drastic estrogen and progesterone changes. But the challenge is if that thyroid starts to change and we don't address it early, it can turn into an autoimmune condition. So if you feel like something is changing in your body that doesn't feel right, I'm going to encourage you to look for the support you need. Okay. HPA axis dysfunction. So this has to do with our adrenals. The HPA axis stands for hypothalamus and pituitary, which is in our brain. And then the A stands for adrenals. your body's undergone a lot of stress, physical stress, okay, during pregnancy, but in the postpartum as well. Having a new little one to take care of, to worry about, can be a huge stressor for folks. So those two combinations can create a little bit of a dysfunction in that HPA axis. Okay. So this can look like fatigue. It can look like, again, changes in sleep. It can look like not being able to handle stress as well. And so making sure that we address that is important as well. And then, of course, mood and anxiety disorders. Okay. Now, I know other practitioners have talked to you guys, you're going to hear next about postpartum depression and baby blues and a little bit of the differences, and paying attention to what our mood feels like, looks like, right? Again, some of that can be transitional for folks, and some of that people might need a little extra support. Okay, so being mindful of that, I think it is really important as well. So I'm going to wrap up with sharing when to seek help. Okay. So like I said, you're going to experience a lot of changes in your body, physically, emotionally, your mood, and that's going to occur throughout the postpartum period. Okay? So that may start in the third trimester for some folks, and then move into the postpartum. Oops. I got so close. But when to seek help? If your changes continue past 4 months postpartum, consider reaching out, right? At that time, I believe a thorough evaluation and testing may be necessary to identify areas of concern. You're not alone, so seek support, right? The better health that you're in, the better health baby's going to have, right? So let us help you grow forward and not just bounce back in your journey in your journey. Oh. So this is me. Thank you for sharing your time with me. Again, my name is Dr. Carmen Jones. I'm a naturopathic doctor. I specialize in nutritional counseling and holistic health. And if I can be of service to you, please don't hesitate to reach out. Thank you.